It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, robotic surgery is right here now in the greater Hazleton area. I'm excited. You're going to be excited. Wait till you see what we have to offer you now in healthcare in the greater Hazleton area. Robotic surgery. Now, we're going to learn all about it. For those of you who know about it already, you're going to learn more about it. Today, we have two doctors here who have been very familiar with robotic surgery. Dr. Michael Mahoney, no stranger to the Sam Lesante Show, and of course, Dr. Joshua Nochumson from the Hazleton Wellness Center. Now, first of all, I'm excited about this, okay? You guys is like a piece of cake. You've been doing this a long time. Just for a review, because we have new viewers coming into the area all the time. Tell me a little bit about yourself, doctor.
So I'm a general surgeon here with LVPG. I've been here for about 2 years now, and just watching my practice grow has been great. I like the area. It's a nice, family-oriented area. And
your experience with robotic surgery, and I'll get to Joshua in a minute. Your experience with robotic surgery. Why is this so exciting for the area? Now, this is nothing new, of course, okay? Robotic surgery's been around. But tell me, why you think this is such a great thing.
Well, I think it's great because it's an opportunity to give the patients in the area what they deserve, cutting edge and state-of-the-art care. The robot allows us to do some of the procedures that have already been done in the area and potentially do them better and give patients an easier, less painful recovery.
Now, you used robotic surgery before, robots before.
Correct. Where I trained, we actually integrated the robotics into our training. So I've been using it for 4 to 6 years.
Dr. Nochumson, no stranger to the show, but again, a little bit about yourself.
Yeah, so I recently came to this community from New Jersey where I was in practice for 8 years. Like Mike, I did a residency in general surgery, and I did an extra year of fellowship training in colon and rectal surgery, and have subsequently become familiar with integrating robotic surgery, especially in various colorectal procedures. That it's been a huge asset to particularly rectal cancer procedures that you have to get into very tricky parts of the body in the pelvis. The robot gives you the dexterity and the visualization to do that. And so I've been here just over a month now, and I'm excited and looking forward to offering some of these procedures to the community here. And like what Mike was saying, I think the robot, having it here, stresses the commitment by the hospital to really provide the best care possible for this community and for people who need routine procedures rather than have to go outside the community. Should they wish to stay here, we have the capability to offer those procedures here.
Robotic surgery, and we talked a little bit about this on the show you and I did. It's a unique type of surgery. Okay, what would be the difference between regular surgery and robotic surgery?
Well, I mean, regular surgery, I suppose what that implies is where you have a traditional large incision to get access to, let's say, the intestines or the gallbladder or various parts of the abdomen. Those procedures, which have been done for decades and decades, are great procedures, but they're very morbid in terms of the amount of trauma to the body that they create when you have a big incision, and a lot of manipulation of the tissues there to get to the area that you need to get to. With minimally invasive procedures, these began becoming more prominent in the early 90s with laparoscopic techniques. It was a huge advance over these open procedures because you could make much smaller incisions, have much less trauma to the tissue, and expedite recovery. And robotic surgery is kind of a natural progression from there. It gives you it basically makes the human surgeon better. It's an aid to make us do better surgery by providing us visualization that we wouldn't have had with laparoscopic surgeries. And it's only evolving. It's only going to become more useful to us over the next 5-10 years. It'll help us, may help us suture tissue better than we can now. There's fatigue factors that happen with human beings. The robot doesn't fatigue, and it can perhaps allow us to do procedures even more precisely with less trauma and faster recoveries.
What are some of the surgeries you've done with the robot?
In my training, I actually did quite a range of surgeries, but in my current specialty that I work, basically anything that I do laparoscopically, I've done robotically. The more common procedures are going to be your gallbladders, but also any of the hernias that I do, most of the hernias I do, I should say, can be done with the robot, including either the ventral wall or the groin hernias can be done there. And then also, as Josh mentioned before, I also do some of the colon work, and any of those cases can be done with the robot. And those are the cases that I agree with him. Those are the cases I enjoy doing with the robot most, is because it helps so much.
How much training doctors are involved in preparing yourself to work with the Da Vinci robot? I'll start with you, Josh.
Well, I mean, it's, again, for the surgeons who are using it, most surgeons are already trained in minimally invasive techniques, so it's kind of a natural extension of that, and so it's more a process of becoming familiar with the technology, how the robot itself works, getting it set up on the patient, and for that, the manufacturer of the robot provides a pretty extensive course that facilitates basically the logistical training for that, and then once you get credentialed through that process, then each hospital is a little bit different, but they set up a proctoring system where you have an expert robotic surgeon proctor other surgeons who are using the robots until they're up to speed with it. And so there is a learning curve, anytime you start a new technology and a new procedure, which is for the robot maybe roughly 20 to 30 cases, something along those lines.
Yeah. So, Doctor, you've been working with the robots for a while now, right? The technology, okay, to explain to the viewers as to why this is so advanced. Something foreign sometimes for people who have not used to any type of technology. They get nervous. I told you, I'm the biggest baby walking. You're going to be operated by a robot. Wait a minute. Now, where's the doctor here? I mean, so it's a little scary to a degree. So how do I become non-scary?
So one thing to think about is the robot's not actually doing anything new, and we're not necessarily creating new procedures. The robots, think of it more as a new tool that we get to use, and it's an advanced tool. It's equivalent to a carpenter using a hand screwdriver versus a power screwdriver.
Good analogy.
So we're not creating new things, we're just using better instruments to do the same process. One of the things I tell patients when I'm talking about the difference between that versus a standard laparoscopic procedure is, imagine me trying to do the procedure with chopsticks with your standard laparoscopic procedure versus me using my fingers and wrists with the robot. And I'm sure, as we'll demonstrate later, it's just the dexterity is so much better, and also the clarity of what I'm seeing. It's the difference between looking at a TV, or with the robot, it's like looking at a virtual reality machine.
So folks, as we're talking, you're seeing the demonstrations, and you're seeing how this particular robot works. I think it's fascinating, folks. We're here at the Hazleton Hospital and operating room number 6. No, I didn't become a doctor yet, even though I'm an honorary doctor in one area, but the point is that we have something exciting now for the greater Hazleton area, but I want to make sure that I feel comfortable. God forbid I should come up for an operation. Would the robotic surgery be fantastic for me? We come back, we'll talk a little bit more about this, and then how does one get to the surgery with the robots? We'll be back right after this. Welcome back to the Sam Lesante Show. Remember, folks, 24/7, you can watch all of our health shows. And if you haven't downloaded our app, I advise you to do that. Search SSP TV, download the app, and you can watch all the shows we produce, particularly a show like this. So you can watch it, get a good education on robotic surgery now at the Hazleton Hospital here at Lehigh Valley Hazleton Hospital. I'm excited. This is great. I have two great doctors here, Dr. Nochumson and Dr. Mahoney. No stranger to the Sam Lesante Show. So first of all, before you even sit at this particular robot, you need to be trained to do that, okay? So once again, okay, what would be some common conditions? Like, could you do hemorrhoids, with robotic surgery? Because I know you do a lot of hemorrhoid operation. I mean, I'm just asking, like, what would be some of the things, common surgeries you
Generally, something relatively straightforward like a hemorrhoid that's almost external to the body, you wouldn't necessarily use the robot for. I mean, there are procedures a little higher in the rectum that you can use a type of robotic surgery, not like what we're going to demonstrate today. But generally we would use this, at least at this institution, for abdominal procedures. So, common things like gallbladders, hernias, and then in the field of colorectal surgery, obviously colon resections, rectal resections. People who have rectal prolapse, we can fix those robotically. Just a quick 10-minute hemorrhoid surgery would be a little bit overkill from the robot.
But you do those, you do the hemorrhoid
We
surgery.
do hemorrhoid surgery, of course, yeah.
Can I request robotic surgery, or is there a procedure I have to go through?
Well, a lot of people come to the office, having read up on robotic surgery and asking if that's something that gets done. I think it's important to realize that robotic surgery is just one of many types of surgery available. And for any given patient, for any given situation, it's very important to have a conversation with your doctor, your surgeon, about what the best possible surgical procedure, whether that's robotic or laparoscopic or open, is for any given person. So it's not the case where in any situation the robotic procedure is always the superior procedure. So it has to be chosen on an individualized basis.
Okay, so Dr. Mahoney, so what we're doing is that you're fine-tuning here when a patient comes to you, whether whether it can be robotic surgery or not. Okay, but here's the situation. Now I'm watching the show, I'm getting all excited, we're going to show a demonstration how this works and why it's so efficient. Now I'm going to say, I want robotic surgery. I want to be robotic surgery. What do you do then?
Well, hopefully you'd have a condition that requires surgery in the first place. But I think Josh kind of summarized it very well there, just to explain a different way. If you have a condition that needs surgery, we look at each patient individually. And if it's appropriate for you to have robotic surgery, anybody that's robotics trained, I think, would kind of push that as far as helping to treat the patient appropriately. There are some patients that aren't candidates for robotic surgery.
And who would patients be?
It depends on what you're being operated for. Sometimes it's comorbid conditions, such as if you can't have general anesthesia because of your heart or your lungs.
Okay.
Other patients that have conditions that have huge problems that require that old-fashioned open incision also wouldn't be good candidates for robotic surgery. Maybe a hybrid procedure, but again, there's so many variables that each patient has to really be looked at as an individual, and then as a group, the surgeon and the patient can come together and decide which surgery is appropriate.
So a common question, I know I would ask this question, is it safe? Josh, you want to start with that?
Well,
I know you don't have the magic wand now, okay?
I mean, this goes to the heart of, is any surgical procedure safe? I mean, there's a lot of checks and balances in the process of undergoing surgery and in training surgeons. And surgeons, there's a reason that we spend a lot of time going through training process, getting very little sleep and doing lots and lots of cases, is to be familiar with the procedures, to be familiar with the anatomy and the new technologies as they're being brought online. So I think you want to, when it's time to discuss possible surgical options, you want to get a sense for what is your surgeon's experience with this procedure, how many procedures has he or she done, and go about it that way. But in general, just like any new technology, early on in its adaptation, and the same is true with robotics, there may have been slightly higher incidence of certain complications, but now this has been around for almost 2 decades, so a lot of those issues have been sorted out. And the same was true for laparoscopic procedures. When that began to be implemented, there was a learning curve with implementing that technology. And so,
folks, in case you just tuned in, we're here at the Lehigh Valley Hospital operating room, and this is the new robotic surgery. New, not new, but new to our hospital here, which we're interviewing Drs. Nochumson and Dr. Mahoney, who have had experience with this particular surgery. And any information you need to find out, it's a very familiar number, 570-401-LVH. That's 570-501-4LVH. So, okay, so now we talked about the technology, the latest in technology, correct? This unit here is latest technology. So we're going to show you now, folks. Dr. Mahoney is going to explain what Dr. Nochumson is doing. He'll show you the actual, this is a demonstration, of course, and then, show us why this is such a great thing.
So the robots actually consisted of 3 parts. The first part is the surgeon console. That's where the surgeon that's operating sits and controls the robot. The tower in the background with the TV on it is kind of the brains of the operation. That's where the main computer is, and that's what communicates between the tower and then the patient cart. This is the arms, and this is what's actually doing the work inside of the patient. The robot's set up to simulate a patient. This is obviously a training tool, but these are the ports that would go inside the patient. So if you can imagine where these black lines are, that's about where these ports get inserted. And then everything from here down would be what's going on the inside. This is the camera, so that it can show us and communicate with the tower so you can see. But then as you can see, Josh is starting to manipulate the arms. He's moving around the rubber bands and just showing the overall dexterity of the machine. We can't do this with any other instruments currently on the market for minimally invasive surgery. As you can see, he can twist his wrists, he can rotate around, and he can open and close the instruments. These are just 2 of the many options that we have for the robot as well. There's cutting instruments, stapling instruments, instruments designed to hold suture needles so that we can tie sutures on the inside without making big incisions. And there's just many other instruments that are coming out as the technology grows to make our jobs easier and more efficient in the OR.
So you can see, folks, why this is such a huge story for our area. And so one of the questions is, having the robot right here, okay, in our community, what does it mean to our residents and referring providers? You want to take it, Mike?
Well, I think we talked about this earlier in the show, and that's that we're able to provide state-of-the-art care to the residents of the area without them leaving to the bigger cities or bigger hospitals. We can perform many or most of the procedures that they may have had to have left for previously. So that's exciting that they don't have to drive an hour or 2 hours. They can get the same state-of-the-art care right here in town.
Let me address that for a moment, folks. Since we've been doing these shows, and I've been a strong supporter of our local doctors and the medical people we have here. When I tell you, when you compare what we have in our area in terms of doctors such as Nochumson and Mahoney, I'm telling you, folks, we have great doctors in this area. These people here really are trained and know what they're doing. And I want to compliment you, the both of you, okay? And I mean that sincerely. I've been criticized many years ago, we got to go out of town. Well, those things have stopped. And now, because we got guys like you, and women who are doing a great job. And I just have to mention that. And for those of you who have any questions whatsoever, just go to their website or know about these guys. That's why we bring them on the Sam Lesante Show. Just for a review, the robotic surgery is new to us here in Hazleton, but certainly not new. You mentioned it's been around for 2 decades, right? Okay. And when you started, you trained in robotic surgery. So once again, give me the advantages for those people just tuning in, why robotic surgery is such a great thing, okay?
Well, I think for certain procedures in particular, especially what I would use for procedures down in the pelvis with colon tumors or rectal tumors or a lot of gynecologic surgery in the pelvis, the robot can get you into parts of the body that are a very tight fit. And previously, those procedures may have had to been done in an open fashion with a big incision, which could involve a much longer recovery, more pain, perhaps more blood loss, perhaps more loss of certain types of functions, sexual functions, things of that sort. So the robot gives you much more advantages in terms of doing a procedure with much less tissue trauma, much earlier recovery, and it's better surgery overall. You can see a lot better. You have much more dexterity with your hands, and it helps the surgeon do a better job operating.
Dr. Mahoney, what about recovery time? You find is, like he alluded a little bit of that. So is the recovery time less, when you're going robotic surgery?
Yeah, it can cut down recovery.
In cases you've done. Give me an example of what you've done.
So for instance, the big recovery for us in general surgery is going to be in your larger bowel cases and also with ventral hernias. The way we had to fixate mesh in ventral hernias before the robot were painful. Now with the robot, instead of somebody staying overnight, we send them home right from surgery. You wake up and go home with very little pain. So it can significantly decrease your recovery time depending on the case. But colon surgery, you're home in 2 days. You know, it's amazing. Before, you're in the hospital a week, bare minimum.
So the common surgeries would be what then? I mean the common ones.
So again, the common ones that we would perform is general and colorectal surgeries. Are going to be your smaller cases like your gallbladders, and most of your hernias can also be attempted this way as well. But then more invasively, your colon surgeries, some of your rectal surgeries, some of your foregut surgeries such as the heartburn surgeries like stomach wraps. All of those things could be an option for you robotically if you see a surgeon that's trained such.
Folks, we're here at the Hazleton, Lehigh Valley Hazleton Hospital, and we're introducing to the area robotic surgery. Certainly nothing new with people. The two doctors have been trained in working robotic surgery. Once again, any information you need about this, it's 570-501-4LVH. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. We're on location here at Lehigh Valley Hospital in operating room number 6. No, I'm not a doctor yet, but they have me dressed up, make sure that I'm in the right procedure here. We're Doctors Nochumson and Dr. Mahoney, who've been trained on robotic surgery. Yes, robotic surgery is now here in the greater Hazleton area. You had mentioned about some common things that we could do with surgery. What are some additional things that the robotic surgery could do? Mike?
So again, we've been talking a lot about general and colorectal because that's what we do, but actually in the scope of the technology of the robot, general surgeons were kind of late to the party. Gynecologic surgeons, urologists, they have all been using this technology to be down in the pelvis for a long time. So some of the procedures they do, like hysterectomies, prostatectomies, nephrectomies, can all be done robotically. And obviously I'm not an expert in any of those fields, but those are just a couple of it. They're available, and you just have to discuss that with your individual provider whether they do that procedure or not.
Okay. And so Dr. Nochumson, you feel that the you're excited about this because you've been doing robotic surgery, okay? Different kind of a procedure, shortened recovery time, and so far, I mean, again, no one has a magic wand and saying it's 100%, but I mean, so far it's been extremely safe.
Well, just again, under the proper training conditions, you need a well-trained surgeon who's been doing these types of procedures before, a team around that surgeon who's very familiar with operating the robot and anesthesia and the whole scope of the surgical team comes into play at this point. But of course, like as I mentioned before, you have to, when having a discussion with your surgeon about a particular procedure, make sure you have a comfort level with your surgeon and the training that he or she has and the number of robotic procedures that he or she has done in the past.
So folks, Dr. Nochumson and Dr. Mahoney, they are certified in robotic surgery. And we're excited. We're really excited here at Lehigh Valley Hospital once again, upgrading the healthcare system. Fantastic. Information about robotic surgery, if you want, the number is 570-501-4LVH for any information whatsoever. And remember, I highly recommend you download our app, which is SSP TV, and you can hit the Sam Lesante Show. You can. If someone wants to know about this, they could look at the app, and they're no strangers to the show. I really enjoyed having the both of you on. This is the 4th time you said on the Sam Lesante.
This is the 4th time. Yeah. I appreciate it.
When you hit 6, you get like a silver star, okay? I wish you the best. And remember, folks, please check your doctors in this area before you decide that you think it's best out of town. Because we have extremely, extremely well-qualified doctors, nurses, nurse practitioners, LPNs, anyone who works in the hospital. I found them been absolutely fantastic. So once again, 570-501-4LVH. We'll see you next time on the Sam Lesante Show.